This really is the epicenter of the drug trade at least in the Mekong. If you look at the heroin trade in the region, it is the epicenter, really. If you look at the meth, it's one of the key players. We're also looking at the production itself, which is taking place here in the country. So looking at the sources of the drugs. So if it's heroin, it would be Shan State, North Shan, South Shan. We're working actually with the government in South Shan. And then if it's methamphetamine, it's scattered around some of the different ceasefire group areas. So talking to them about how we can reduce the trafficking flows that are coming out of that. And then we're also talking about drug use and drug treatment, which is for us actually one of the areas which we're really trying to prioritize now, is how we can improve the delivery of drug treatment through the public health system. We've actually, with the government and the actually surrounding country governments, agreed on a new modality for drug treatment that will, from our perspective, be much more effective than what they're delivering at the moment. So the tradition here has been something called compulsory drug treatment. Basically, someone is a drug user, they come in contact with the justice system, they get put into treatment, but it's not voluntary, not necessarily based on medical efficacy or medical scientific evidence. We've come up with the WHO, World Health Organization, a program called community-based treatment, which helps stream people into appropriate treatment that is voluntary and evidence-based. At a fundamental level, you need things to be voluntary. People who volunteer for medical treatment tend to go into it because they want results, which means they're going to go in, they're going in of their own volition, they want to come out the other side not using drugs. When people are forced into drug treatment or they end up in prison, often there's no rehabilitative effect. It doesn't actually reduce any drug use or harm type activities. So this will improve the outcome of the treatment. Geographically specific, you can make it basically anywhere. You can make it here in Yangon, you can make it in Shan State. Obviously, it's mainly made in places in Shan where the government doesn't have control of the territory. But the fact of the matter is we don't exactly know where it comes from. So you can't trace it back to source, which means you have to develop intelligence on the networks that are trafficking it. And the networks that make methamphetamine are very different than those that make heroin because they're very small, tight-knit. It's an integrated business model compared to, say, opiates. So you have the tendency for these groups to be able to smuggle from varying points, and as you just touched on, they can use new techniques. They can kind of embed it in, you've just said chilies, they can embed it in any product essentially. So it's really hard. I just come back to the point on the drugs. At the very beginning, I mentioned something called precursors. This country does not have a chemical industry. Both major drug types that are made here, be it heroin or methamphetamine, require chemical flow to make the drugs. And the drugs are made here in high volume, which means there's high volume of chemicals coming in and high volume of drugs going out. So a very big active two-way trade of things going in and out of the country. We really are going to be making a push on regional cooperation to stop or slow the chemical trade into the drug producing areas, because that'll really hopefully make a bit of a dent in the production. So we're really pushing the line of regional cooperation, getting the neighbors to work with the country on that. They obviously want action on the drugs coming out, but we also have to help them with the chemicals coming in. So I think we'd really emphasize that that's something which is underappreciated and needs a lot more attention.